Hello, Study Nurse IQ family. Welcome back to the channel. I'm Jenny, and today we're doing a quick review over the antibiotic class known as the sulfonamides. Please stick with me to the end, as we have 3 NCLEX style questions to test your knowledge on the material. Let's get started. Sulfonamides, the sulfa drugs. The sulfonamide class of antibiotics is easily recognizable because their names share a common prefix, sulfa, S-U-L-F-A. Some popular medications in this class include sulfamethoxazole and sulfadiazine. A drug you'll see all the time is the combination medication of sulfamethoxazole and trimethoprim, which is most commonly known by the brand name Bactrim. Spectrum and uses. Sulfonamides have a broad spectrum of activity. They go after both gram-positive and gram-negative bacteria. What makes them especially useful is that they can also target certain protozoal infections, parasitic infections. Because of this broad coverage, they are used to treat a wide range of issues. Urinary tract infections, MRSA, methicillin-resistant Staphylococcus aureus infections, bowel, ear, and lung infections, parasitic infections such as toxoplasmosis. Mechanism of action. Sulfonamides have a really interesting way of stopping bacteria. They are bacteriostatic, which means they don't necessarily kill the bacteria outright, but they stop them from reproducing. They achieve this by inhibiting folic acid synthesis. Bacteria need to make their own folic acid, also called folate, to build DNA and survive. Sulfonamides act as a competitive inhibitor, blocking the necessary enzyme in the bacterial folic acid pathway. This is a critical concept to remember because it ties into some of our key nursing considerations. What you must remember, the sulfa mnemonic. We can use the word sulfa to remember the most important nursing considerations for this class. S is for sensitivity to sulfa and sun. Allergy risk. Patients can have allergic reactions with this class. It's quite common. These reactions can sometimes progress to a very severe and dangerous condition known as Stevens-Johnson syndrome. This condition involves widespread, severe inflammation, blistering, and peeling of the skin and mucous membranes. It is very painful and life-threatening, so you must look for any sign of rash or allergic reaction and stop the medication immediately. Photosensitivity. Sulfonamides can cause the skin to be photosensitive, meaning the sun can easily irritate and damage it. You must educate your patients to use sunscreen when going outside and to absolutely avoid tanning booths. U is for under-the-radar interactions. You must use caution with other medications your patient might be taking because sulfonamides can actually increase the effects of other drugs. Warfarin. They can increase the effects of the blood thinner warfarin, raising the risk of bleeding by increasing the patient's INR, International Normalized Ratio. Phenytoin. They can increase the effects of the seizure medication phenytoin, which can lead to neurotoxicity. Sulfonylureas. These are oral medications used for diabetes. Sulfonamides can increase their effects, leading to an increased risk of hypoglycemia, low blood sugar. The catch-all here is to monitor labs closely, especially INR and blood glucose, and watch for signs of toxicity. Is for liver toxicity. Sulfonamides can also have an effect on the liver, sometimes causing liver toxicity. This can cause liver enzymes to elevate. You need to monitor the patient's liver function tests, LFTs, especially if they are using this drug long-term. F is for folic acid synthesis block and folate deficiency. Remember how these drugs block folic acid synthesis? This is why the class is generally avoided during pregnancy, especially during the first and third trimesters. First trimester. Folic acid is crucial for fetal development. Blocking it increases the risk of birth defects and megaloblastic anemia in the mother and fetus. Third trimester. Using the drug late in pregnancy can cause a serious condition in the newborn called kernicterus. This is where high levels of unconjugated bilirubin accumulate, which can cross into the brain and cause permanent brain damage. This class is also avoided in patients who already have a folate deficiency because it can worsen the deficiency and lead to that severe megaloblastic anemia. Check your patient's history. For instance, if your patient has a history of chronic alcohol use, they are already at high risk for nutrient deficiencies, including folic acid, and often have underlying liver impairment. These patients are high risk for sulfonamide use. A is for adequate fluid intake. The patient must maintain adequate fluid intake while taking this class to help prevent crystalluria. Crystalluria is when drug crystals form in the urine, which can damage the kidneys. You should educate the patient to drink at least 2 liters, 2 L of fluid per day while on this medication, unless there is a fluid restriction or other contraindication. Monitor their urinary output and their renal labs like BUN and creatinine. Now let's test your knowledge with some NCLEX-style questions. Question 1. A nurse is teaching a patient who is starting a prescription for sulfamethoxazole and trimethoprim, Bactrim. Which instruction is the most critical to include regarding medication safety? A. Take the medication on an empty stomach to improve absorption. B. Wear protective clothing and use sunscreen when you go outside. C. Limit your intake of foods high in vitamin K, such as leafy greens. D. Monitor your heart rate for signs of bradycardia. The answer is B. Wear protective clothing and use sunscreen when you go outside. Rationale. Sulfonamides cause photosensitivity, making the skin highly susceptible to sun damage. The most critical safety instruction is to protect the skin from the sun using sunscreen and protective clothing to prevent severe reactions. Question 2. A nurse is reviewing the medication list for a patient prescribed a sulfonamide. The nurse notes the patient is also taking warfarin. The nurse should anticipate which potential drug interaction. A. Increased risk of hypoglycemia. B. Decreased effectiveness of the antibiotic. C. Increased risk of bleeding. D. Decreased absorption of the warfarin. The answer is C. Increased risk of bleeding. Sulfonamides can intensify the effects of warfarin, a blood thinner. This interaction increases the patient's INR, international normalized ratio, which puts them at a significantly higher risk for bleeding. Question 3. A patient is receiving a sulfonamide for a urinary tract infection. The nurse should emphasize the importance of drinking at least 2 liters of fluid daily to prevent which adverse effect? A. Pseudomembranous colitis. B. Stevens-Johnson syndrome. C. Crystalluria. D. Megaloblastic anemia. The answer is C. Crystalluria. Rationale. High fluid intake, adequate hydration, is essential when taking sulfonamides to prevent the formation of drug crystals in the urine, a condition called crystalluria, which can lead to kidney damage. That wraps up this review on sulfonamides. We covered their mechanism of action, their broad coverage, and the crucial safety points you need to remember. If this video was of value or added value to you, please head to our YouTube channel Study Nurse IQ and click subscribe. We'll be continuing our antibiotics series in the next video. I'm Jenny, and I'll see you next time.